around climate change and health, but also holding to account
Good to see you.
governments, industry, civil society organisations to do something about this disaster that we have in front of us. What the report is telling us, and we'll hear over the course of the evening, is we need to do an awful lot more and an awful lot better, and with a very, very explicit attention to equity. We'll see and we'll hear of just how truly awful climate change is exacerbating social inequities and what that means for health. So let's do something about social inequities. And of course that helps us adapt in a more equitable way. And then, very importantly, we have to address the underlying drivers, the common drivers of climate change and poor health. I argue that that's sometimes referred to as the consumptogenic system that drives the excessive production, consumption of harmful goods, services, harmful for the environment, harmful for health, and that are very, very unequally valued and distributed. So we're going to hear how Australia has been faring in all of this in what will be just a marvellous evening, I think. And before I hand over, I do just want to pay special tribute to Paul Beggs in the audience. Paul was the lead author for the Australian report. So any hard questions, direct them all to Paul, who's just here. But really, just an incredible leadership, Paul, in making this happen. It's like we know, like herding cats, getting folks to do this, but really, really important. So with no further ado, it's my huge privilege to welcome Ngunnawal Elder Serena Williams.
Thank you for that introduction. My name's Serena Williams and I'm a proud Ngunnawal Wiradjuri woman and elder in this community. I'd like to acknowledge first of all Francis Nuna, a Torres Strait Islander man from Bardu Islands. It was a pleasure meeting you this evening, and I'd like to acknowledge any other Aboriginal Torres Strait Islander people here. Also the Chief Minister for Health, who's here this evening, and another minister that I've just noticed coming in. I'm learning a lot of new faces, and as an emerging elder, you know, I like to deliver in a very unique way how I do Welcome to Country. And one thing that I was talking to Paul about earlier about doing the Welcome to Country is I actually do a bit of research on what you know, the subject's about. So I have a bit of an understanding and I can talk a bit how it affects myself, my people, my country, my lands. And climate change is one of the hot topics, you know, how it actually affects us, you know, through economically, socially, as Aboriginal Torres Strait Islander people, and through our health. And I think that, you know, as Aboriginal Torres Strait Islander people, our social, you know, is getting smaller. And I think that, you know, I would just want to point out one of our beautiful songlines here. You'll see Mount Ainslie, Black Mount Tower, where Telstra Tower is. And then on the other side, you may just see another mountain, which is Mount Ainslie. And that's the breast of one of our women's songlines. And her rib cages are right on the ANU. So I'd like to thank the ANU for inviting me here. But I just want to know that, yeah, the rib cage is right there. And maybe that's where, you know, all that power and knowledge comes from, the skill. Because, you know, as a proud Ngunnawal woman, you know, there's a lot of storyline within that woman. And, you know, it goes the stomach, and the womb that sits up on Capitol Hill, and her feet, they actually sit in the Murrumbidgee River, and her hair runs out to Lake Warrawara, which is known as Lake George. So I just wanted to point out one of those songlines. And unfortunately, here in Western society, concrete's been built, roads have been built, buildings have been built, and it's affected our songlines, you know, and we have a long history of trauma as Aboriginal and Torres Strait Islander people, but we still are connected and caring for the land and the waters. We still have story, we still have continuation of who we are, and a history and a knowledge that is still being passed on for many, many, many generations. You know, It affects everywhere. My husband is of PNG descent, and I know this is happening in the Torres Strait Islander, where the islands are actually going underwater, and how do we keep who we are and our stories alive when all of this goes underwater? And it's up to all people, all Australians, everyone globally around the world to have an impact of making change for the global crisis that we're having. We've had the floods, we've had the fires, we've had a pandemic of COVID, which has affected us quite dramatically. With that say, a welcome to country is an understanding of your business here on country, and I'd like to say that I'd like to acknowledge the business that you're having here on country, acknowledging the MJA-Lancet Countdown, the reports that have come back, and I'd like to acknowledge Paul, for being courageous on the 5th report to put something out so bold, and that's what I think our community, our people and our government needs. And particularly having Francis here, to bring his knowledge and skill set in an academic way around Aboriginal and Torres Strait Islander engagement, the stakeholdership and how it's affecting the Torres Strait Islands, but also around Australia and the country. So I'd like to acknowledge my elders past, present and future. I'd like to acknowledge again all Aboriginal Torres Strait Islander people and all you wonderful people that are in the room this evening to be a part of this and go forward with it. Yeramura. I'd like to sweep the lands for you to leave your footprints on. Hello, welcome. Najan, water of the Royal, the Murrumbidgee, the Molonglo and the Gudjimbi, that will cleanse you of all harm. Malian is a wedge-tailed eagle. She will guide, protect and oversee you on your journey here on Ngunnawal country. On behalf of all the Ngunnawal families, welcome, welcome, welcome to beautiful Ngunnawal country. You can see how lovely it is, eh? Some of us are very privileged. Thank you. Have a lovely evening.
Thank you so much. So let's move on. Where's Steve gone? I've lost our speaker. No, he's out. Yes. So, Steve, do you know you're up next? Yes. Yeah. You were looking at me like, what? So, huge privilege now to introduce Professor Steve Robson, President of the AMA. Don't hold that against him. But really, look at his bio. It is phenomenal. Really, I mean, just phenomenal. Have a look at it. I'm not going to read it all out. We're very lucky to have Steve at the ANU, also as President of the AMA, but really having such a passion for equity in all sorts of forms across healthcare. So, Steve, over to you.
Thanks very much, Sharon. It is an absolute honour and a privilege to be here this evening, and I want to just start by acknowledging how privileged I feel to be here on Ngunnawal land, and I want to acknowledge the First Nations Australians here and your leaders past, present and emerging. And I'm not using that as a platitude or something you meant to do. I think it's absolutely clear that First Nations Australians have been great stewards of the land that we're on for tens of thousands of years and understand that we don't have dominion over the land or the atmosphere, that we actually are a part of that. And it's critical that we live in balance with the environment in which we live. My grandmother's family actually live on Thursday Island and are Torres Strait Islanders up there involved in healthcare these days, and I've had a long sense of that. Over recent years, it's been very obvious that things are changing and once-in-a-century events are happening all the time. Very recently, I went to Lismore, where the town had been wiped out by an extraordinary deluge. And I spent some time with the doctors and nurses and pharmacists and people who were struggling to provide health care to Lismore and the surrounding community, and it was an absolute eye-opener. But these things are happening. We're seeing it again in Victoria. We've seen extraordinary changes in the climate. A couple of years ago, I wrote about the fact that when the bushfires were affecting Canberra and we were stuck in that bushfire smoke for so long, I was delivering babies into smoke, and it was an extraordinary thing that the next generation of Australians were being born like this. In fact, I just put something on social media that ended up going around the world because people were so horrified about what was happening here. And I think it speaks to the fact that the climate crisis is for us a health crisis or a series of evolving and worsening health crises. And it's hard not to respond to these crises as a medical doctor. Now, I'm the Professor of Reproductive Medicine at the ANU, and I was delighted to hear the uterus is under Capitol Hill because my laboratory is at Deakin, so it's probably very convenient. My career has been entirely about families, about people wanting to start a family, about people judging how many children they want to have, and about the size of their family. And my entire career, whether it's the clinical work I do, the research, teaching, is about the next generation of Australians. That has been my entire clinical career for over 30 years. And we're here tonight talking about the health and the well-being of the next generation and indeed of their children. And I find that this is something that absolutely touches me deeply. I cannot think of a more important issue for doctors, both here and globally. We even know that the health system in Australia is a large contributor to greenhouse gases. And we know that these gases have effects that most importantly affect vulnerable people, often remote from where we're generating the gases. The Australian Medical Association works closely with Doctors for the Environment, and we see climate change and the effects on people's health as a fundamental issue for the health. It's part of my own research. I've got a paper coming out very soon in which we ask that new medical research should not be approved ethically without a statement about the environmental effect. And we shouldn't look at a new medical treatment just compared to an old medical treatment. We should say, what effect does it have on the environment? And maybe its clinical improvement may be offset by an effect on the environment. So that paper's coming out shortly. This is an issue that's fundamentally important to me. And I think it has to be a new lens for health and a new paradigm for the way we practice. Anyway, on behalf of the Federal Australian Medical Association, I welcome this report and I welcome everybody involved in it. And I'm very excited to be part of the launch tonight. Thank you all very much.
Steve, thank you. And I think hearing, so the AMA is an incredibly important and incredibly powerful organisation. Having the AMA come out so strongly about climate change as a fundamental health issue must be taken very, very seriously. So just fantastic that the AMA is so strongly behind this, and with your leadership, Steve, so fantastic. So a huge pleasure now to introduce Dr. Jacqueline Small. Jacqueline is the president of the Royal Australasian College of Physicians. Again, also vitally important, incredibly powerful organisation, and vitally important having that voice. Again, I mean, it's so beautiful reading people's bios. It's so impressive. And I don't have time to read it all out. I encourage you to read it. But really just the importance. We're hearing a story of young people coming through in our speakers. You'll hear now from Jacqueline in relation to climate and health. But thank you.
Thank you, and I'd like to thank the organisers for inviting me as President of the RACP to be here today. I'd also like to pay my respects to the Ngunnawal people and all Indigenous people who are here today. And as Steve said, we've got a lot to learn if we increasingly centralise the experience of Indigenous communities in our health service delivery, planning and teaching and education. I think we'll go a long way. Steve's spoken about the connection to land, but I think the understanding of health and wellbeing community goes well beyond that. And I think what we need to improve our health system and improve health resilience are healthier communities. The RACP is very proud to be part of this initiative, and we have been since 2017. So we're pleased to be supporting the launch of the MJA-Lancet Countdown Australian Policy Brief again this year and to be here as part of your launch. These types of collaborations across our sectors and within the health sector and all of those who contribute to it are vital for change. This is such a major problem for our health system and for our communities. We won't achieve the change unless we do collaborate effectively. And I'll speak a little bit more, sorry, next slide I think, not sure if I'm controlling those. I'll speak a little bit more in a moment about some of the collaborations the RACP has managed to initiate, and we're really proud of that. I've also heard the Minister for Health, Mark Butler, say quite recently that good climate change policy is good health policy. And I think this policy brief speaks to that as well when it looks at sustainable food delivery. It's quite remarkable to think that if we actually were all able to eat a recommended food diet, we'd have a 42% reduction in the impact on our climate change. So I think that's quite remarkable, and I think that's another example of where good health policy and good climate policy align. I think as well, most of our community are now convinced that climate change is real. So I think it is time to start trying to evolve the messaging that we're giving our community, and I suspect that's probably a really good one for those who are interested in health and wellbeing, particularly within our health sector. Within the RACP, climate change is one of the key areas of advocacy. We surveyed our members last year, and there was quite strong support for climate change. So I can stand here with authority of our now over 30,000 members who see that climate change is one of the biggest global threats to our health in the 21st century, but also biggest opportunity to really look at and understand how we can do differently in relation to socioeconomic determinants of health. Those most at risk of climate change are also the most disadvantaged. I think we need to be really mindful of that. So the RACP is a member-led organisation, and many of our members are also taking leadership roles. One's here today, very pleased to be meeting Karen. But also many of our members deliver a range of important health services, from public health physicians to a range of physicians and paediatricians like I am. We all have a role to play in changing the health system. It's not just about delivering, obviously addressing the causes of climate change, but new models of healthcare that might also improve health outcomes, particularly for the vulnerable, might also be very effective in looking at addressing climate change. So we were very proud to lead over the last couple of years a collaboration across 9 other medical colleges, and additional medical colleges have joined since, representing the initial collaboration represented over 100,000 medical specialists across Australia and New Zealand, quite a powerful group of committed medical specialists to see change in the health system and improvement of health in recognition of the climate risk we're facing. So the Climate Change in Australia's Healthcare System, a review of the literature, policy and practice, drew together evidence base, case studies, and to review a policy analysis and an economic analysis. So I commend that to you. It's available on our website. And it really looked at the evidence for change currently and highlighted that there's very little, there has been quite limited leadership at a national level in Australia, and limited policies and limited and decreasing investment in research in relation to climate change. So it does identify that a range of themes are important, from evidence-based action, which we know is important in healthcare delivery, leadership, diverse knowledge, particularly in relation to Indigenous knowledge, and collaboration. So that's important in bringing about change, but it's also important in working with to improve the health system. So this review found that there was already evidence of effective interventions in high quality studies to bring about change within the health system, to continue to adapt the health system to climate change. Currently, our health system contributes to 7% of the emissions in Australia, quite a sizable impact. So the health system needs to do its bit to reduce climate change. And so initiatives such as telemedicine to reduce travel and potentially even improve access to healthcare is one mechanism, training of healthcare workers, and other initiatives such as reducing the amount of throwaway devices we have and changing anaesthetic gases. So I commend this to you because it does identify a range of actions we can be taking now. Other medical colleges are joining us, but in relation to what Steve was saying just now, in relation to looking at the interventions we're recommending for clinical purposes, increasingly we're aware we need to also take account of the impact on climate change. And I'm really pleased that my rheumatology colleagues are putting a position statement together to do just that. So I can see that the groups in the healthcare setting are really engaging in this space and taking it seriously and partnering the recommendations around climate change and health. So I just want to add my congratulations to everyone who's been involved with this, all the other stakeholders, and see this as a vital initiative, one that's obviously got much more life in it. We're really at the beginning of seeing systematic climate change action in Australia, particularly in the health setting, and I think that this is just the start of our advocacy. There's much more to come. So thank you everyone for inviting us.
Marvellous, and it's so hopeful. You know, that it's such a power of numbers. Did I get that right? More than 30,000 members in your through there. I mean, phenomenal. What a voice calling for change. Fantastic. And I also sort of took out of what you said, Jacqueline, so in the absence of what of course has been the wilderness at the national level in terms of political leadership, those different forms of leadership that we see happening. And I do also just want to acknowledge the ACT government because you've been we've been first movers in so many things. With energy, with well-being, the whole well-being framework, with climate change, obviously, circular economy. So there's just the lovely spread of activities within the colleges, within the healthcare setting, and then across these others. So really, I thought I was going to be so despairing this evening, and this is so hopeful. I'm going to work very hard at keeping us all hopeful. So, do we have Alice online? Where's Toby? Yep, Alice is online. So, lovely now to introduce Dr. Alice McGushan, who's joining us from England. Yes, so 7 o'clock in the morning, I think, for you, Alice. I don't know if you can see and hear us okay. Thank you so much for joining us. Alice is a public health registrar in the east of England. You might tell us a little bit more about where you are, and of course we're going to hear what you're up to, but has been really fundamentally central to the sort of the global Lancet Countdown initiative. So please do read her bio, and over to you, Alice. Now we can see your notes pages, so maybe you want to change your setting.
No
that
problem.
thing at the
I'll
top.
just turn it back around.
Yeah.
Got two screens, so that's why.
Yeah, that's perfect. Perfect.
You
Thank
can hear me all okay?
Yep, we can see your slides are perfect. We can see you and we can hear you. Lovely.
Perfect. Okay. Well, thank you all so much for having me to speak today. And thank you to Serena, Sharon, Steve, and Jacqueline before me for speaking to Australia's important context and start picture. So I'm going to take us back a step to view the global context and present the key messages of the 2022 global report published in the Lancet last week. So every year since 2015, the Lancet has published our annual report, which tracks the world as it responds to the health threats of climate change and seeks opportunities to improve human health. However, each year, our indicators have demonstrated continued inaction to the worsening health threats and inequalities resulting from our ongoing addiction to fossil fuels. This year's report, published last week, has three key messages. A persistent fossil fuel addiction is driving a rapid increase in the negative impacts of climate change on the health and well-being of people in every country. Around the world, we are seeing worsening food insecurity, extreme heat, climate-related disasters, and risk of infectious disease outbreaks. At the same time, households are still dependent on the use of dirty fuels for energy, leaving them vulnerable to rising fossil fuel prices, energy poverty, and air pollution. Increasing frequency of heat waves resulted in an additional 98 million people reporting moderate to medium food insecurity in the 103 countries studied in 2020, an impact that could be worsened by and exacerbate the effects of COVID-19 pandemic and the war in Ukraine on people's access to food and cost of living. However, governments in both high and low income countries continue to subsidize fossil fuels to a sum of $400 billion in 2019 alone. In many cases, these sums are comparable or even exceeding their annual health budget. As countries strive to respond to the current energy crisis, many governments are backsliding to fossil fuels in short-sighted responses, which could reverse progress made to date. And while the energy and cost of living crises undermine lives and livelihoods, fossil fuel giants are making record profits and delaying their transition to renewable energies. Despite climate change commitments to reduce their own carbon impact, evidence suggests that the current production strategies of 15 of the world's largest oil and gas companies would generate emissions that would exceed their share consistent with 1.5 degrees by 103% by 2040. But there is still time to take the path towards a healthier future. Accelerating the response to climate change will not only avoid an increase in the climate change related death and disease, but also deliver immediate health benefits through improved energy access and security, cleaner air, healthier diets, and friendlier, more livable cities. These routes would contribute to a safe and healthier future in which people around the world would not only survive, but thrive. So thank you so much for having me to speak today, and I wish you a productive discussion. Thank you.
Lovely, thank you, Alice. So now you've made me very despairing. Yeah, I suppose just such a sober reminder of the power of really some of those very strong vested interests in the sea of hope that we've heard about so far. We cannot forget that there are very strong vested interests in all of this. So we're going to move slightly in our format now. I've lost track of time, Toby. You're not. I'm not doing my job. Perfect. I knew that. So do we have Dan online? So we're going to do something a little bit different now. Really, in terms of just sort of putting a pause for the moment, so important that we've heard about the support, the advocacy, the strength of voice across the colleges, the AMA, the RCP, and then against that sort of backdrop of the sober reality of the continuing power of the fossil fuel industry, basically. But learning that there are so many different ways of working within this governance system that change can happen. And we're going to hear that now from Dan. So Dan, actually I don't know how to pronounce your surname, Dan, I'm really sorry, Dan Illich, who's going to, Dan, a major comedian, does all sorts of interesting stuff. His podcast, live comedy show, A Rational Fear, we're going to hear about that now. So really a lovely illustration of another way of making change happen, using different strategies to make change happen. So Dan, you're going to sort of be with us or take us through this for about 10 minutes or so, is that right? And then we're going to move into a panel discussion. So over to you now. Thank you.
Oh, thank you so much. And it's such a great privilege to be joining you from Naarm. Sorry I couldn't be there in person. My name is Dan Illich and I'm an investigative humorist. I'm a little bit of a comedian, a little bit of a journalist. And what I like to do is kind of bring the big issues to audiences all around the world in kind of a funny way. And that's what I do with Irrational Fear. We've been talking about climate for a long time on Irrational Fear podcast. And we do live shows all around the world. Though this is me at COP21. I really enjoyed going to COP21, and during lockdown in last year, I intended to take Irrational Fear, my live comedy podcast, to the pubs of Glasgow to do live shows in Glasgow. But unfortunately, someone forgot to reply to some emails from Pfizer and no one was allowed to go. It was a weird time, 2021. It's hard to imagine now, but we were all locked in our houses 1 year ago. It's very strange. Well, not many of you in Canberra. You were sensible. You were doing some fine work there, thanks to your policies there. But for the rest of us, we were definitely in lockdown. And all I was wondering was how do I take this live show that we do in front of audiences and talk about climate change to Glasgow? There must be a way I can do something. I'm just a guy in my bedroom on day 94 of lockdown. What can I do to have some kind of impact in Glasgow? So it was a weird thing because it's a really important thing for us to go there because we are the third largest exporter of fossil fuels behind Saudi Arabia and Russia. We're basically the bad guy at these kind of events. You know, the world hates us. We are the Barnaby Joyce of world politics, and we need our government to step up and do more. Even now, we need our governments to do more. And what's more, what was so more irritating about this was that Scott Morrison himself decided he wasn't going to go to Glasgow. And that made me furious. I got so annoyed. Because he decided it would distract from his normal duties as Prime Minister. That's right. Doing something would prevent him from doing nothing. And so I wanted to send a message to the world. I thought, well, I'm going to figure out how I can have an impact at COP. So I decided to buy a billboard in the middle of Glasgow. It was going to cost me $12,000. Thankfully, I had the money, so I could buy it, but I was wondering if my audience could chip in to help me pay for it. And with this digital billboard in Glasgow, I could put up 3 bits of artwork. So I told the crowdfunding group that I was going to put up this one, Cuddle a Koala Before We Make Them Extinct, Australia, net zero by 2300, with a kangaroo on fire there. I just thought, someone might have thought that was a typo, and maybe Angus Taylor would be saying, hey, congratulations on the 2030 commitment. That wasn't the case at all. And then the third one I gave as an option that you could actually build your own billboard if you chipped into the crowdfunding campaign. So I created this campaign. It's on the 27th of September at 6:30 in the morning. I sent an email to my email list, and then I got $12,000 at 8:30 a.m. Yes, 2 hours. And I managed to get $12,000 to pay for this billboard, which was amazing. And then the money kept going. Oh, someone in that 2 hours bought the $4,000 billboard to put their own message up, which is amazing. It was an Australian celebrity. They said, I said to them, oh, what do you want on the billboard? They said, yeah, how about this? Yeah, look, sorry about our government bullshitting. Kind regards, Australia. Overwhelming majority of residents. Is there a poll we can refer to? And I said, yes, there is a poll. Thanks to the ACF, they did the poll. The 75% poll that came out beginning of last year. At the end of day one, I raised $40,000 and the money just kept coming in. A couple of days later, I earned $80,000. I was on the project. I was doing all sorts of media, and I learned 3 things from this. I learned 3 things. That 1, people want climate action. 2, I'm going to need more billboards. And 3, I'm going to need bigger, billboards. So I decided to book the biggest billboard I could find in Times Square. It wraps around a whole city block. It's so big they call it Godzilla. That's how big it is. It costs $100,000 an hour, but I did a deal. I did a New York deal. I managed to get it for 10 minutes for a much lesser price. And I managed to convert our artwork into billboards that would wrap around the full city block. This one, I invited other comedians to chip in. This is from The Chaser. They pitched Crocodile Dundee, which was very good. This is another one, New York Colicon, special guest Matt Canavan, winner of Best Cole Cosplay 2020. This one from Sydney designer Sean Marsh. We're rich in sunshine, wind and climate denial. And I turned one of my tweets into a new product called Australian Government Against Humanity. And this made me so furious during the pandemic. I don't know about you, but all I could think of, it was so crazy. We had this gas-led recovery. This is like the Cards Against Humanity game. So this is like a typical flop. During a deadly pandemic, form a commission to fix the problem by building a gas pipeline. I don't know about you, but I'm pretty sure that's not how you fix a respiratory disease. I'm talking to a room full of doctors here. I'm sure you very much well know that. And then, of course, our secret Australian celebrity got their billboard up on this one as well. So let's have a look here. I had the invoices paid. I invited hundreds of New Yorkers or hundreds of Aussies I knew in New York down to see it live for the 10 minutes. And then I also had the press invited. And then this happened. I put up an invitation for people to go see the billboard, and Russell Crowe told Jake Tapper on Twitter, and he said, "Hey, Jake Tapper, have you seen this?" And Jake Tapper said, "I had not. Thanks, Russell Crowe." So that was amazing. So 9:45 a.m. in Australia, I was searching YouTube for any kind of webcam that would help me see this billboard, and I found one at 9:45, and there it was. There's the kangaroo on fire. This has been filming my TV, by the way. Look at that. That is fantastic. Just amazing. So good. What a thrill. And there we are, embarrassing Australia on the globe stage. Just absolutely phenomenal thing. Oh, this is actually my favorite billboard in the corner here. It says, "Missing person, last seen doing nothing, answers to ScoMo and the coal lobby." Yeah, so that's my personal favorite. I really enjoyed that one. Oh, yes, and I also made it onto Jake Tapper and had a great chat with my good friend Jake Tapper. Yeah, so 8:15, October 15, is Scott Morrison going to Glasgow? 9:45 a.m. when the billboards went up. At that point, no, Scott Morrison wasn't going to Glasgow. Then at 2 p.m, yes, he held a press conference to say he was gonna go to Glasgow. It's amazing. Oh my God, it's amazing what a few $100,000 worth of marketing will do to get a marketing guy to go to Glasgow. Really good stuff there. This proves that this whole government is run by the Engadine Doctrine. I don't know if you know about this doctrine. It is a doctrine that basically the whole government is run by the principle of miring and indecision until the march of time forces an action upon you. That is the Engadine Doctrine. That previous government ran by. So Glasgow, we also bought extra billboards. We got billboards on the highways. Look at that, fantastic. We got billboards in the suburbs of Glasgow. And we also raised so much money, we could buy billboards in Australia. This is Armidale. This is in Barnaby Joyce's electorate. I believe this billboard is still up because no one really wants to buy billboard space in Armidale. I don't know why. So Barnaby Joyce gets to drive past this when he goes to McDonald's. So that's very exciting. This one's in Horsham, in country Victoria, in Torquay. And then we got some extra billboards to put around different telephones. This is in Sylvania Waters. This is done by a Tasmanian artist. It says, "Visit the old growth stumps of Tasmania." And I don't know if you can look carefully there. There's a wombat upside down there. Beautiful work there. Then there's this one in Sutherland. It says, "Hawaiian hideaway for when things get too hot at home. Bushfire sale now on." Of course, harking back to a time when the Prime Minister escaped the bushfires went away. And then this is one of my favorites. "Welcome to Engadine, the place where Scott Morrison last did anything." Ask your kids about what that means. And this one was, forgive the typo in this, but I had a group of people who donated to the billboard campaign, JokeKeeper, and they said, "Can you do something about the future and education and climate? We want something." And I said, "Okay, how about this? In 2035, Cassie will be qualified to put former politicians in jail for historical climate crimes. Climate prosecutor is one of the 1 million new Australian jobs in a fossil-free future." That was great. And then in Hawthorn, it was interesting in Hawthorn, in Kooyong, Media said that I couldn't put any political billboards up. They said, as long as it wasn't political, I could put it up. So this, of course, was famously Josh Frydenberg's lecturate. So I put this one up instead. I said, is it okay if I sell a standing desk? They said, yes. And I said, okay, great. So I said, hey, big space, it's time to buy a standing desk because you're about to lose your seat. This was before the election, of course. And I left a big space because I thought someone might spray paint the word Josh. And if that's the case, so be it. Someone did spray paint this particular artwork, but they wrote Frydenberg at the bottom. It's a lot more sinister. Hey, it's time to buy a standing desk because you're about to lose your seat, Frydenberg. It feels a bit more nasty, but hey, you know, it worked for me. And incidentally, Media gave me a call. They said, unfortunately, we're going to have to take this billboard down because this billboard is now political. And I said, I understand. And then a few months later, they replaced it with this one. Yeah. So apparently you're not allowed political advertising unless you are running the government of the day. So what this taught me was that climate change can sometimes make us all feel powerless, but using our own power, we can all become powerful. And that's my story. Thanks for listening. And I'm excited to get our next thing on the go. Would you like to introduce the panel or shall I?
But shall I introduce them because I can see where they're sitting?
Yeah,
But
that'll be
first of all,
great. Thank you.
Marvelous. Really marvellous. And as a Glaswegian, I would love you to actually go to Glasgow. We would love you in Glasgow. Please go. That was just awesome. So Dan is going to facilitate the panel discussion now. So let me bring the panellists up to join us at the front. So first of all, I'd like to invite Dr. Kerry Coleman. Kerry needs no introduction for any Canberrans. You know her. She is our ACT Chief Health Officer who is still smiling. Thank you. Thank you. Then we have Associate Professor Aparna Lal. Aparna is a great colleague from the ANU. She's at the National Centre for Epidemiology and Population Health. She's an ecologist and a public health scientist. We have Francis Nona, who's a lecturer and researcher at UQ, University of Queensland, from the School of Public Health. A long career as a nurse, yes. Really interesting. Thank you. Now, Toby, do we have Tim? No. Okay. So pressure on the three of you then. So, unfortunately, Tim Flannery he's hurt his neck, so he can't join us. I think. So Dan, can you see the panel?
Yes, I can. They all look very good, and the Arboretum looks terrific too. Thank you, Sharon.
Lovely. Over to you.
All right. No, I know the reason why Tim isn't here because I was going to ask him about why the dams are full. The dams are full, Tim. That's a little joke. Don't worry about that. Hey, it's great to be with you for this incredible panel with such a great lineup. I really appreciate it. I actually asked everyone here to write their own hard-hitting question, so that would make me look like an asshole, but make them look really good. So I'm going to kick it off with Aparna. Aparna, what can the world possibly learn from the younger generation? They're so young with their TikToks and their doohickeys.
Thanks, Dan. I don't know if you can see the room and see how many young people there are actually here tonight. And it's absolutely fantastic to see. I mean, I guess we all know how engaged the youth are in terms of their climate futures and how invested they are in what they want their futures to look like. But I think in addition to this huge passion they have, they're also really well informed. and they have a world of information at their fingertips. But yet I find they're largely missing from decision-making tables and conversations. And I would love to see, I loved reading this recent Lancet report because I think that there's a huge space for them to be included, for their voices to be heard, especially in the indicators around public engagement, media engagement, and seeing what the youth actually think in terms of solutions look like. We're aware of the impacts, but they're also really clued up on what.
All right. Thank you so much. That is absolutely terrific. And wow, you speak so good for a young person. It's really amazing. Look, and the next hard-hitting question, Francis wrote for himself, and I actually tend to, I tend to echo this sentiment, Francis. The Torres Strait is so remote and far away from where I live. Why should climate change effect on this place? Why should this place matter to me at all? It's so far away, Torres Strait.
And absolutely that it is. As you're all aware, I'm from Torres Straits and I grew up in Torres Straits. But when I see the current landscape of Torres Straits and seeing the changing climate, and then see where we have storm surges on the Gold Coast, we react straight away. We have $1 million houses, we have people that pay taxes, and we react. But yet, for generations, we are starting to see the changing climate in the Torres Straits, and let me tell you, we don't react. So my call out is to see these changes and think, why are we still facing the challenges that we face, but yet when you buy $1 million house and you get sand erosion, tractors will come and support you. And this is the question that I pose, that, why aren't we, supporting First Nations people and the vulnerable communities that are living every day, the changes that are affecting their way they live, who they are as their Indigenous identity and their beings. But we have this government that supports what is it to us, whether it's taxpayers' money, whether it's taxes on new houses, that we will react when we've got communities that are being displaced. And so I think that we should be advocating and echoing these changes as we sit here on the mainland or in the cities.
Yeah. Thank you, Francis. And it is heartening, even though it is one small step, to see the Torres Strait 8 get their ruling in the UN in Geneva just 2 weeks ago. I had a chat with who is it? One of the complainants from Masig, just a couple of months ago, last year actually, and just so heartbreaking to hear their story. And when you put it in a way that we could actually lose an entire culture to climate action, to climate change, it's so disheartening. So we need to centre First Nations folks more, absolutely. Dr. Karen, you didn't write a hard-hitting question for yourself, but I'll ask you one. You took over the role of Chief Health Officer in 2019. I assume it's been pretty easy since 2019?
That's a really easy question to answer. No. And no, I didn't get time to consider sending you a question. But I think what I have been dealing with as Chief Health Officer absolutely underlies what we're talking about here today. Walking into the job was bushfires, and as several people have already talked to today, while we did not have the impact at this time of the fire itself in the ACT, we certainly had an extended period of very high levels of smoke with extensive impact on our air quality, and the implications of that was something that I had never thought through prior to that particular point in time, and to have to do that extraordinarily quickly. And I think some of the really surprising things that came to me were the involvement and the leaning forward of the entire community in trying to solve some of the issues. The thing that I have a real memory of is being tasked with getting masks out to vulnerable community members, and I'm sitting there thinking, holy moly, how the hell do we do this? but every single person came forward. We had pharmacists on board, we had the PSA, we had everybody coming forward. So I think that in a crisis like that, people lean forward to be part of how do we protect those most at risk, but how do we capture that? And how do we actually plan to use that in more BAU so that we don't have to respond in that way? That wasn't really answering your question, but that was where my conversation led me.
Well, it seems like 2 years on since you've been appointed, life's really easy for you now. So thank you. It's such a privilege to speak with you all. A big, broad question for the panel here. Like, why do you think climate change and climate change discourse rarely includes health conversations in our media? Maybe Aparna, you want to kick off on that?
Sorry, Dan. So to clarify, you want to know around media around health and climate change, is that?
Yeah, in climate change discourse, we rarely hear about health implications. It's all carbon emissions, it's all energy, it's all solar panels, it's all sea level rise, but we never really have, health is very rarely centered in media conversations around climate. Why do you think that is?
I think one of the issues around the conversations are that a lot of conversations that I watch are around mitigation, and all of the mitigation conversations are around exactly what you said, Dan, solar panels, EVs, those sorts of things. But what we are hearing from the communities that we live in, and I'd love to hear Frances's take on this, is around adaptation to the here and the now. And I think that's where health plays a central role as well, in terms of our conversations about how do we prepare people for the health impacts and the solutions of a more climate resilient health system going forward.
Frances, let's talk about that. For First Nations folks, climate change, as you mentioned, is an immediate and existential threat. You know, for folks in the cities, it's something that is coming, but for First Nations folks, many of them live in more climate vulnerable areas in our cities. It's a real threat. How can First Nations folks mitigate health risks associated with climate change?
To even answer that question quite easily is to get them at the table and let's start having First Nations voices at the table that are affecting their needs. And I think when we step around health impacts due to climate change, I think once you make it personal, once you make it relating to health, it becomes a problem. But when it's about a community or when it's abroad, it's still a wicked problem. And a wicked problem can be dodged and, you know, funding doesn't have to go to it because no one can actually put their finger on it. But when you make it personal and you make it about health, you have to react. And I think when we look at the quantitative data and we see that we're working outside the parameters, as a clinician, if you're outside of those parameters, you have to react, whether it's through medication or an intervention through surgery. But we are seeing those parameters outside of those safe guidelines, but yet we do nothing about it because it's not a human context. But First Nations people have been facing these poor health outcomes due to climate, and we're still not doing anything about it. So how can we respond looking externally to these communities? Is first thing we should be doing is putting them at the front and saying, when we need your expertise, we need your voice, how do we go about this? Because it's a vulnerable space to say, you know, to the first scientists, to the first researchers of the land to go, well, I'm going to give up my power and give it to you. Can you tell us how do we get around this? It is a vulnerable position, but it's the people who are vulnerable that are actually facing these issues. And again, from a clinician point of view, if I'm on the ward working as a registered nurse and someone's outside those parameters, I have to react. Well, the government is that clinician that's not reacting when we're outside those parameters because it's personal.
Yeah, well, let's talk to the government right now. Dr. Karen Coleman, how are you bringing First Nations people to this conversation? How are you inviting them to the table?
Thank you, Dan. I'm not here really representing the government, but we do have some government members here, so I won't be speaking on behalf of the government, but I can talk to some of the ways in perhaps which we have and we do engage with our more vulnerable communities in the ACT, and First Nations are one of those priority groups here. And I think that we have many really good conversations in the ACT, some of which are some embedded really strong governance mechanisms, and we have an elected body and we have people around the table here all steps of the way in which we take a decision. But we also embed, and we have a consumers representation, we have a vast array of community of culturally and linguistically diverse communities who are represented at our table. So I think one of the things we do in the ACT is look at everything we do and the decisions that we make and policies that we make, and how do we actually make sure that that voice is embedded and heard where it's appropriate. I've just been reflecting on what both my colleagues have set up here in terms of why, because I often feel that as well. I hear the conversation happening around climate change and it talks around how are we going to reduce emissions, how are we going to reduce the impact, whereas and I think that that's really hard for people. The message about health is generally through an indirect mechanism. Often it's not a direct thing, it doesn't have meaning. I was listening to Frances talk about people, it becomes real for people when it becomes individual. It's someone that they know. And very rarely sitting around the ACT, I think, or even in New South Wales or Victoria, except when there's a bushfire or something acute like that, it's not real. It's more this general feeling that happens, I think. And it's added to something else. So I think it's about a tangibility, maybe, in terms of the health impact and making that real for people. And maybe Aparna might like to, I know that Aparna and I have talked a little bit about communication and how we message and how do we bring people along. And that one of the things I learnt during COVID was very much risk communications is make it real for people. What does it mean for you? What do you feel and what do you need to own, and how can you actually contribute to the change that has an impact for your family?
Aparna, do you want to add to that?
Yeah, sure. Thanks, Karen. Yes, and I also think that one of the things that was front and center about COVID is how health is such a shared value for different communities across the country. And I think getting climate change, that same value, is going to be how we get traction on climate change, making it personal, making the stories count for other people. So just very briefly, to give you an example, my father-in-law is a farmer in New Zealand, and there's a lot of emissions due to agriculture in New Zealand. It's one of their biggest emitters. And so when you talk to farmers there, they have invested so much money over the last 20 years on trying to deal with droughts, trying to deal with lower water flow. So they know that the climate is changing. But as soon as you say, do you believe in climate change, they will take a step back. So it's not about people don't believe in climate change. It's about what do they value and how is that changing in a changing climate? And can we then have those shared conversations around slightly different values, but talking about climate change?
That's interesting, Aparna. One of the recommendations of the Lancet report is perhaps we should be changing our diet. So I'll throw it back to you, Aparna. Are you trying to kill the barbecue? Is it all over? Are you trying to raise the stakes, Aparna?
Thanks, Dan. I will actually might throw that question to Sharon because that. Karen, do you want to take that one?
I would flip that question. Oh God, no, I love the barbecue more than probably as much as anyone else does here. But I think for me, I work in the population health space, so very looking at what we do with populations. What are our prevention opportunities? And I think there are real opportunities in terms of our healthy lifestyle prevention messages to leverage what is called co-benefits of in this space. And no, it doesn't mean that you don't have to. But you know what? You can cook on your barbecue. You can cook eggplant on your barbecue and zucchini on your barbecue. That's actually really nice. But you can also have the odd sausage. But maybe that goes to Aparna's conversation around values. How do we actually tap people? Healthy diet's not just about that it makes me feel good, but I can actually contribute to this bigger thing called climate change and this evolution by actually choosing differently about what I eat.
And if I could say something, Dan, when we label something as a healthy diet, who has access to that healthy diet? You know, it's one to change someone's diet, but if we think about food security, what is the access to what diet they're receiving? When I think of like remote communities and we think of the poor health outcomes that some of these communities are facing, and we say, well, let's just change their diet. but yet we're not putting in interventions so that they have access to it. So an indicator is one to measure, but an indicator to apply is a different thing. So when we think of who's actually having a healthy diet, it's the people that have, you know, I'll call it as it is. It's the privilege of actually having access to a healthy diet to then make the decision of what I can eat or can't eat. But does food or the agriculture contribute to climate change? Absolutely. But who are the people that are keeping these businesses afloat? The minority aren't, because they don't have access to it, but yet they've got poor health outcomes because the food that they have access to is probably something that we won't touch here because it doesn't sit in the pyramid of nutrition. So we've got to think bigger and broader than what we are labelling things, because it marginalises the people that we then go and measure the poor health outcomes to say we've got a problem, but it's at their cost.
Yeah. Francis, what kind of healthcare systems are you looking to see come into First Nations communities to kind of mitigate climate related illness?
Yeah, so AMSs, which is Aboriginal Medical Services, they've led this. Redfern started there first. It's voices within communities delivering services culturally safe and so forth. But when I hear health services, and I work in a health service, and it'll probably get me in trouble, it's reactive. You need the problem. Otherwise, no one's employed. Let's put it that way. And when you think of big states delivering healthcare, and the biggest workforce is health, it's a double-edged sword. We need people sick so that we can deliver the health and employ people. But if everyone was healthy, these systems will go down, and it doesn't generate what governments need. So when I think in Torres Straits, we don't have the health system to support what we're facing. When I think of remote communities, as a CEO in an Aboriginal medical service, we were constantly dictated by funding. We knew what we wanted, but KPIs attached to funding, we couldn't actually do it. We couldn't do or get the outcomes, and when we did, it'll be 12 months, and then they will change those KPIs. And it's so hard to deliver healthcare in Indigenous communities based on the building behind me that has a flag saying what these communities need. And it's not even the voices of. It's now we're now talking about funding, on the way we should deliver healthcare. And then you go to some communities and they don't even have the health services, let alone the skill sets to deliver what's needed. So we send these community members and displace them and send them to, towns or regional towns to access specialists. And the commonality of this culture that's happening is, when I think of First Nations people in Torres Straits, they fly down to Cairns to access specialists for CKD and CVD, and they actually are so scared to go because they're going to come back as freight. And if we put one and one together, how do you go down as a passenger to a city and go back as freight? And it's, people are scared to come back in boxes, and this is the problem that we have. But yet we need to support these regions with specialists.
So a big kind of education push to change health outcomes in the first place before people get sick is part of the problem here, right?
But it's unmeasurable. Health promotion exists, we need it, but you can't measure it because you don't know if you impacted it. It exists and it's needed, but the money is reactive. And when I think for specialists, you put where the need is, but then, when I think where the vulnerable communities are, it's hard to deliver because you've got to change the infrastructure. It's based on money.
Yeah. Aparna, are our health systems at all ready for more climate-related illness?
So Dan, just reading the Australian Lancet report, but also the more global report, I think one of the key challenges is going to be for health systems is around the huge gaps in data quality. Just following on from Francis's, what he's saying is that, we have all of these great indicators in Australia, and we are tracking progress, but we can only track progress in countries that have systems that allow us to do so. In communities that do not have the infrastructure, as Francis was saying, do not have the software, do not have the capacity or the skills, we don't know what we don't know. And these are the countries that are going to be hugely impacted by climate change. So to answer your question about are health systems ready, they can be ready in countries that have the capacity to do so, but in countries that are going to have disproportionately heavy impacts, they currently don't have the infrastructure to do so. And I don't know if you know, Dan, a couple of hours ago or a day ago at COP27, they've just released this climate health platform, which is a WMO and a WHO knowledge platform that's global. So any community can go there and you can look at your risks, you can look at the hazards. But one of the key things they've said is that out of 50% of countries now have national adaptation and vulnerability risk assessments, but only 9 of them have now allocated resources based on those risk assessments. So they've put this huge amount of effort into getting these risk assessments done, but there's no allocation of resources to help these countries deal with it.
It's only a little bit depressing. So thanks, Aparna. I really appreciate that. What about on the ACT? Is the ACT ready for more climate illness? Karen?
I think that the ACT, as has already been indicated, I was going to say Hillary, but it's Sharon now, has actually been very forward-leaning in terms of a centralised governance mechanism and a centralised ability to provide a climate change strategy as well as provide support for risk assessments across the different aspects, including health. I admit health has probably been a little bit behind as we've been focusing on COVID, but we are getting our act together now and we are having a bit more of a look at what does our health system look like in the ACT. And by a health system, I'm a little bit in Francis' camp. There's the hospital and the tertiary level, and they really need to be able to look after themselves. And I just kind of say, off you go, guys. We have seen them really stretched in the last couple of years, and we have seen the ebbs and flows from COVID and from bushfires. But it's only one of the pressures for our tertiary hospital systems. There are so many other pressures, and we do have a new territory-wide health services plan which identifies those pressures that are going to push our demand. So I actually think that we have the governance mechanisms in place and the systems to actually work through those, whether we can or not, as everyone, operationalisation of those is really the challenging next step that we need to go through. I think the work we need to do here in the ACT is look broader than that. What about our community services? What about our NGO services? These are the guys who reach out to the people and the cohorts who are going to be much more at risk of what we've already talked about. And therefore, how are we going to set our social system around that to support that? We have so many lessons learned from COVID that we can leverage in this space, but there's still some more work to do. But from a partners conversation, we are so lucky here, and we will certainly not feel impacts seen in other jurisdictions in remote and regional areas and overseas.
Yeah, as somebody who was in lockdown for over 100 days, help us in the ACT, help us! Teach the people how to do the thing!
Is that just coughing with your elbow? The easy thing?
In a second, we'll be able to do Q&A from the audience. But before we do that, I just want to know, what is the immediate health gains for getting off fossil fuels? Aparna, let's hear from you.
The immediate health gains.
There are so many. There are so many. I mean, a lot of the... And I'd just like to digress here briefly, Dan, in talking about the health co-benefits. We're all talking about the health co-benefits of different actions, which include things like decarbonisation, which include things like physical activity, active transport, those sorts of things. But we do need to be aware that anything we do in terms of the health gains has to be equitable and it has to be sustainable. And that requires more voices at the table. And I was listening to this really interesting podcast where in Europe, where they're no longer talking about health co-benefits, but they're actually talking about health co-impacts of decarbonisation. So one of the things we don't really talk about is when we talk about these interventions is we talk about the benefits, but we don't talk about the unintended consequences, which may be negative. And we don't really have a handle on what the risks are to populations that don't currently have a voice on the table, at the table. And one of the things we do have to talk about in terms of any of these interventions, move away from fossil fuels, which we have to do, is about having a holistic or a more nuanced understanding of what the risks and the benefits are.
It is an astounding figure that I think Jacqueline Small said earlier today, that out of industry emissions, the health industry is 7%. I just don't think about the health industry making up such a huge chunk of emissions. What's the way forward with the health industry in terms of reducing emissions? This is asking of the panel in general here. Like, I don't know who's best to answer this one.
So I'm hesitant to talk a little bit about, so the ACT has definitely done some forward thinking in this space, and for those of you who sit here, you're probably well aware of the Canberra Health Services 20-year transition plan, which is moving towards being fully electric and having many other opportunities. So
Got it right here, bedtime reading, I love it.
There you go, fantastic. I'll let the people know who wrote it. I'll let Liz know. So I think there are things that we can do. I think of it in three different ways. There's things that we can do in terms of building new infrastructure or our new stuff that we're doing. Then there's things within our existing infrastructure that we can do to reduce the reliance on it. Then there are policies, and there are other things that we do in how we run our healthcare. So we can make choices about what we procure, what pharmaceuticals we use. These kinds of decisions really need to be driven nationally, I think, because they rely on a procurement policy. I think that we're really hoping that with the national government stepping into this space, and the current Commonwealth Health Minister announcing the move towards doing a health plan in this space, that we will be able to get leverage onto some of those health systems and policies that we can implement across the board. The other big issue, and I know that both Steve and Jackie mentioned it, was how do we approach value-based care moving forward, where we can be much more efficient in terms of the interventions and the choices that we use. Reflecting on how we made decisions in COVID, where it's actually really quite difficult to make policy decisions considering the health, the social, the economic, finance. We don't actually have a really good way of doing that in government. And I think you both mentioned the ability that it would become increasingly necessary to look at our interventions in medicine, our models of care, our choices of drugs, our choices of surgical procedures potentially, and around what are the offsets and what are the differing impacts of that. That's quite complex. I think that's a really forward-reaching thing. But I think that's one of the things we're going to have to get our head around, because 7% there's a lot of room still to move in there.
All right. I don't know how we're going to manage Q&A because I'm not in the room, but if you feel like you want to ask a question, move near a microphone and ask that question directly into the microphone. And please make it a question, not a comment, not a 10-page essay, and thank you very much. But just if it sounds like your voice should go up at the end, that's probably a good indication of a question. So please find a microphone and feel free to ask a question. And we might need a mic jockey, someone who can run around with a microphone so the folks online can hear. I think there's about 40 of us still online, so that'll be great.
Love it. And I just wanted to check, are you comfortable fielding the questions, Dan, or do you want me to do that? Very happy either way.
Well, if you can field it, I can't see anything. Oh, there, I can see myself now. Oh my God, we're zoomed out. Oh my God, why didn't anyone tell me I was so ugly? Jesus.
Okay, well,
Go for it.
keep
Yeah,
an eye
you pick some
hands.
folks, and we'll wrap up.
Okay, so we'll come back to Steve. So we'll go up to Satiris and then Steve.
Thanks so much. Thanks for the amazing launch of the MJA report. Thanks to the panel, and thanks Paul for leading us this amazing work. I would like to ask the panel, Karen in particular, about the indicators and the impact these indicators have in policy making. There are many indicators. The headline of 7% of the carbon footprint of the health sector obviously is one prominent indicator. What will help in your work and your interaction with government to instigate action on climate change? Which kind of indicators? We have exposure indicators. Some indicators focus on mitigation. Is there a preferred one for yourself? Is there one that makes a difference, or if there's one missing from the list that will make a difference?
So I'll preface my... As I think I have said to some of you, I don't see myself as an expert in climate change at all. So I don't feel that I can comment on the specific indicators, but maybe I could talk to what makes a useful indicator for us. It has to have meaning to the outcome that we're trying to achieve. So it has to be really explicit to be able to, in conversations with our leaders, we have to be able to demonstrate that it links and that we can show a change in that. I think if the indicators are able to leverage or link into other policy areas that we're working in, and for the ACT government, that would be the wellbeing indicators. So anything that has multiple uses where we could actually monitor and look at cross-leverage benefits. I'm sorry, I can't, but I think this is some of the kind of work that we're looking to work with you guys at HEAL as well as Apana in some of the translational information about what's on the table, how can we make use of them, and what would be the best fit for us here. So I look forward to those conversations.
All right, thank you. Next question.
Hi. At the moment, patients in Australia have no visibility whatsoever of the environmental impact of any treatment choices they make. And that is terrible. If I do a laparoscopic operation, it releases the same amount of carbon as running a room air conditioner for an entire summer. That's one operation. And I think the absolute most urgent thing we could do straight away is to provide metrics for patients about the carbon and environmental impact of every treatment that they might be asked to think about, because we know the community is highly concerned about climate change, and I think this would be something we could do tomorrow that would have a major impact on health choices people make and potentially reduce carbon output from healthcare straight away by getting the community on side and understanding the impact of treatment they're having.
More of a comment than a question, but thank you very much. Any other questions?
There's one up the back just coming. Yes, thank you.
Sorry, I can't stand up for any long length of time, so I'll just say it. I have been very concerned since the COVID outbreak about the amount of waste generated through that, and I wondered whether, I mean, my hairdresser up until a couple of months ago was still using a big sheet of plastic to cover me instead of having the reusable covers that they used to have. And the number of masks that you see lying around the street, I've been appalled. And some time ago I became aware that there's a lot of plastic speculums around. We're too lazy to sterilise the metal ones? I just find all that stuff appalling, and I wondered whether any thought is being given to that problem, and are we going to see some kind of reduction in that kind of waste through the health system?
I'm happy to acknowledge that. I think you're exactly right. And I think when I lost my words earlier about what the third thing that we need to do is very much look at what are the contributors to emissions in terms of how we use our products, what interventions we do, what are they using and what are our trade-offs and how we do that. That needs to be absolutely done at a national level because we need some really strong leadership and we need the parameters within which we can do that. Because word of caution in here, we do need to recognise that some of those choices and putting some of that information will have unintended consequences, so it needs to be a thoughtful consideration in that space. But couldn't agree more. And the PPE waste from COVID just makes me sick. But I do think sometimes we have an acute issue where we're dealing with the threat in front of us right now, and climate change, unfortunately, is a much more issue much more down here, and we will always choose to protect ourselves from this one as a choice as opposed to that one. So how do we reset?
Yeah, that is a tough conversation to have. Thank you for that. Let's just do two more questions and then we'll head off to networking.
Do we have any questions online can you see them online at all?
No, I can't see any in the chat. If you do have a question online, please feel free to put it in the chat and I'll ask the question.
Okay. Well, Whilst
We
yes,
can't
we
put
have one.
questions. The chat's blocked.
You can, sorry, chat's blocked, is it? Oh, no. We'll figure that out.
Well, so we have another question in the room. Yes.
Hi, so I have a bit of a question around low-value healthcare, which is a term I've been hearing about in the climate change space for a little while now. So I was sort of just wondering, how can the health system, whether that be doctors or more broadly people in government, balance the discussion around low-value healthcare, but while still achieving like patient outcomes and still making sure that people are getting the healthcare that they need and feel empowered to have that choice?
I can't help but think when I hear those sort of terminologies get thrown around, what worries me is where are the profits attached that makes it low value? And, you know, as a specialist working within hospitals, you know, what holds the biggest price tag? Because as an employee, we're in it for ourselves, but also, you know, when we think of those low value procedures, we've got to think of outcome for the patient as opposed to, you know, why are we calling it low value? And are we putting it at the forefront that these procedures need to be undertaken for the patient's well-being, or is it low value because I need to reschedule profitable or higher procedures that brings business within? Because I'm still yet to hear that healthcare is profitable and healthcare is a business. Depending which side you're on the fence, there's profits to be made, there's money to be spent, and there's votes to be won. So when I hear low value, who's calling it low value is the bit that worries me. Yeah, is it the patient? Because the patient might think it's high priority. So that's where we've got to watch on how we naming it and who's naming it, which I hear what you're saying though, yeah.
Yeah, I think that's
Thanks for
really
your question.
Oh, sorry, I was just going to jump in on Francis' comment. I think that goes to the earlier conversation about what is the value we're attributing here, and is this and what are we considering, and how do we do that? And we need to make sure that we're all talking about the same thing when we're having those conversations and discussing them. But they are occurring, and I do know that they are occurring, and I know it's been alluded to here. I don't know if either of the two leads here from colleges would like to talk. Jackie just said she's happy to have it.
Sorry to intrude on the panel discussion. But it's obviously a complex issue to determine whether or not it's low value. A whole lot of choices, practice, history, values, experiences will come into that. But there are some campaigns to recognise that some interventions should not occur. Our college has one that's called Evolve, and we have lists of 5 do not do from a range of special societies that's publicly available. And there's Choosing Wisely, which is also a similar campaign to try and address that. So there are some initiatives to look at reducing and eliminating low value care.
We have a question from our chat. It comes from Lena, who's part of Extinction Rebellion South Australia on Karuna land. Lena asks, when will we have some doctors using their authoritative voices in a doctors' rebellion against the fossil fuel industry?
There's a paper of doctors in Torres Straits who came together to push the issue of climate change. And, you know, Dan, I go back to your PowerPoint, and I can't go away from your second last slide where I see the word powerless. And, you know, when I think of powerless, it's those vulnerable communities. And if we are all feeling powerless, we are now going back into those vulnerable communities. And it's people that hold power, which, if that question comes from, is the person that holds the profession, the doctor. And, you know, their voices are strong. As we said, there was 30,000 that can actually make a movement. And in Torres Straits, they banded together to push a paper out to say that the health impacts for First Nations people in the region, but it made me think that all of a sudden this voice is now strong and it's powerful, but it's come from doctors. And, you know, doctors hold a place in society, but the vulnerable communities hold a place in society, and that's where we've got to uphold in what we call powerful voice and, you know, just another voice, yeah.
I think that's great, planting a flag in the ground and using your power where you can. A similar vein line of question from Liz online. Liz asks, we've heard a lot about social determinants of health impacts of climate change, but is there also a story to be told about the synergies between acting on climate change and social determinants of health? Maybe another one for you, Francis. Is there a positive story to be said? A flag in the ground, if you will.
I mean, there's many great stories, but this is where data saturation can actually change outcomes and where we want to see, we could honestly say, there's great stories to come out, the report shows it, but what impacted was COVID. And that's where we've got to be careful that the data saturation of what is good is because we couldn't do anything anyway. So there's many good stories, and I think of, communities actually having a say to how they receive funding to supplement their communities reacting to climate change is now at the forefront because reports like this actually create it. But I just think with data saturation too, and what becomes a good story because we couldn't do anything in the last 2 years. There are many good stories though that come from it.
Yeah, well, I think that's about all the time we have for our Q&A. So thank you everyone online who's found the chat and dropped their questions in. And thank you in the audience for asking your questions too. And could you please give a round of applause to our insightful and incredible panel. It has been an absolute privilege to hear you all talk. And thanks very much for having me. I can't believe I got asked to do this. Thank you, Hilary, for inviting me along to do this this panel. And I'm sorry you were ill, not being able to come here tonight to be here in person, to watch the Zoom in real life. Oh my God, imagine that. So thank you very much, everyone. I believe right now we've got time for some networking and snacks, everyone's favourite part of the evening.
Brilliant. So please join me. Thank Dan and the panel again. So just before we do break for, please do hang around for lovely networking, chatting, drinks and nibbles up the back. I do have to just really, I suppose, again, just to make the plug for the report that has now been launched. It is a very, very serious issue, the relationship between climate change and health. I think we've heard a lot about the potential power within the healthcare system, within the health profession. It's so important to use that voice. It's also so important to, as health professionals, to engage beyond the health sector. We know that health is produced beyond the health sector, very, very much so. Good housing policy, good social policy, good planning policy is all vitally important for climate change adaptation. It's also really, really important for health. And putting the equity lens across all of that, as the panel have spoken about so strongly, is so important. Otherwise, we are going to see a tsunami of health inequities into the future, exacerbated by this existential threat that is climate change. So please, on that sort of despairing note, this is such an important issue. We've heard all of these glimmers of hope, I think, from all of our colleagues speaking today. And walking out of this room is a call to action for the widening of our coalitions of concerned individuals, concerned organisations, concerned governments, etc. We have to do this collectively. This is not about individual responsibility. It cannot be about individual responsibility. This is a collective action problem. So my final remarks is just a huge thank you to Professor Hilary Bambrick, who very sadly could not be here. Hilary is the Director of the National Centre for Epidemiology and Population Health at the Australian National University, who really was behind this marvellous event. And an enormous thanks to her team, particularly I've been liaising with Toby and all of the colleagues who've just done a marvellous, marvellous job. And thank you for coming along to one of the most beautiful spots in Canberra. It's just delightful. So please, a huge big thank you to all of our speakers, to participants, and please get our minister, don't let him leave this room, to how are we going to champion even more, be even more of a showcase to the world of the great things that we do here in the ACT, but that we must continue to do more of for climate change and health. So thank you.